North East London NHS Foundation Trust is facing further questions this morning after recently being found guilty of serious failings in the care of a young patient who took her own life. Now there are concerns over the deaths of 20 other patients in the Trust's care. And just a warning, this story contains references to suicide. Laura Bundock reports.
The death of Alice Figueiredo has raised serious questions about the NHS Trust responsible for her care, now convicted of health and safety failings. These are the documents detailing a decade of deaths at the North East London Foundation Trust, known as NELFT, including Karis Braithwate, who was friends with Alice at school.
She was a very sweet girl, very kind. She struggled a lot with her life. She struggled a lot as a person.
In October 2018, Karis tried to take her life at a train station. She was admitted to Goodmayes Hospital, where Alice died. Staff discharged her the next day, and within an hour, Karis killed herself at a train station.
100% she could have still been with us if they hadn't done that ridiculous thing. You think about it, and none of that makes any sense whatsoever. The way it was dealt with does not make sense.
Karis's mother told us no family should have to endure this kind of loss and injustice. Without real accountability, mental health services will continue to fail those who rely on them the most. NELFT told us they've carried out an in-depth review of patient safety, resulting in significant changes in the way they assess risk of suicide, as well as improving their record-keeping practices.
Since Alice's death, we've read all the subsequent coroner's reports which call for action and raise concerns about NELFT. Each case different, but there are some strikingly similar themes, including failings to carry out adequate risk assessments and issues with the sharing and recording of information and incidents.
One patient was marked as alive and well, even though he'd taken his own life the day before. Another told staff he was hearing voices telling him to kill himself, yet staff failed to remove the items he later used to take his life. Last year, the Health Secretary, Wes Streeting, gave this damning assessment of the Trust.
I'm very aware of NELFT, not least because NELFT has and continues to appear in the headlines for providing really poor quality care. So if we want to name and shame, I'll do the name and shaming alongside the naming and praising.
Chantal Cushion was admitted to Goodmayes Hospital last year after attempting to take her own life.
We feared every day that the police would turn up to say Chantal's dead. She was in danger in Goodmayes Hospital. She wasn't safe.
Chantal was on suicide watch but escaped from her ward 20 times.
One day, Chantal was told by a nurse, "Don't kill yourself on my shift, wait until you go home and kill yourself." She was told by a nurse. That's not care. That's not helping people. That's telling them, yeah, it's okay, do it, but don't do it at a hospital.
We put these concerns to NELFT, who told us they can't comment on individual cases, but said patient safety is our absolute priority, and we work closely with our patients and their families to ensure we provide compassionate care tailored to their needs. The Trust insists changes have been made, but for many it's not nearly enough. Laura Bundock, Sky News.
And if you've been affected by that report, you can reach out to the Samaritans by calling 116 123 or email joe@samaritans.org, and the details are on the screen now.